Welcome, everyone, to Kickstart Milwaukee, hosted by the Physicians Committee for Responsible Medicine. My name is Terry Lynch. I'm the founder of the Plant-Based Nutrition Organization of Wisconsin, or PBNOW. We call it PBNOW. We are a nonprofit organization established to educate, inspire, and support those interested in evidence-backed plant-based nutrition for their health and improve quality of life. Today's event is being put on by both of our groups, PBNOW and the Physicians Committee for Responsible Medicine, and we're grateful to have you with us. A few housekeeping items to keep in mind. First of all, you might want to hit on the upper portion of your screen. I think you'll find it on the upper portion of your screen. I'm having a hard time finding it myself. The speaker view, so that you see the speaker who's talking and not all the boxes of all the attendees. And a couple other items. If you can keep your microphone on mute throughout the entire presentation, that allows us, everybody, to hear the presenters more clearly and without any background noise. We welcome you to use the chat box to engage with us and other attendees and pose questions throughout the event. We'll be collecting your questions for the final Q&A panel today, so don't hesitate to post them throughout the event. Now, here's what we have in store for you tonight. We will begin with a talk by our PBNOW Medical Director, Dr. Joshua Liberman. He will be followed with a presentation by Dr. Neil Barnard. Dr. Barnard's presentation will cover the topic of his latest book, Your Body in Balance. Next, we'll have a planning session, a meal planning session, with dietitian Allison Tierney. Allison will be followed by a cooking demonstration with local plant-based chef and cooking instructor Amberly Childs. And after Amberly, we'll have the 20-minute Q&A panel with 5 plant-based experts: Dr. Rose Kumar, Dr. Michael Lenz, and Dr. Liberman, Dr. Barnard, and Allison. Now let's get started with our first presenter. Dr. Joshua Liberman is a plant-based fellowship-trained cardiologist practicing here in Milwaukee with Ascension Columbia St. Mary's. He is past president of the Wisconsin chapter of the American College of Cardiology, and he sits on its national prevention subgroup, a group that includes, among others, Dr. Dean Ornish, Dr. Caldwell Esselstyn, and Dr. Barnard, who you'll hear from tonight. Dr. Liberman is also our PBNOW Medical Director and a regular speaker at our monthly meeting. We love having him share his knowledge and how he is helping his patients adopt a plant-based diet for better heart health. Welcome, Dr. Liberman.
Thank you very much, Terry. Appreciate it as always. Hopefully everybody can hear me. You can use your chat function if you have a problem or anything like that, let me know. I will start to share my screen, if that's okay. We got a lot to cover tonight, so I want to go over everything. So thank you all for coming to this joint meeting of PCRM and PBNOW. Here we go. So, sorry. So whenever you do a meeting in the medical education world, you always have to begin with an obligatory quote from somebody respected. So how about Thomas Anderson? The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition, which is obviously why we're here. So I want to tell you about, we don't like to practice what we call anecdotal medicine, where you just hear about one story of one person and you think that that's going to be representative for everybody. But I do want to highlight the power of a plant-based diet and plant-based nutrition and plant-based healthcare, really. And so I want to tell you about a patient of mine, 72-year-old male with a history of heart disease and carotid artery disease, so up in the neck. And unfortunately for him, he also had this condition that was a idiopathic, which meant that we didn't know why it was caused. It wasn't from alcohol use or anything, but he had what we call idiopathic liver cirrhosis. And unfortunately, he had some complications of that. He also had borderline diabetes. And both those are going to play into his management. So started complaining of some chest discomfort, but really actually wasn't investigated for a long time because they were just concerned about his liver problems and whether he would be too much of a bleeding risk. But finally, sorry, that should be 2017, he had a heart catheterization, which revealed that of 3 main blood vessels of the heart, one of them was 100% blocked and the other 2 were 90% blocked. Obviously, this is not what you want to hear. Further, when we looked into it, we did an ultrasound of his neck, and his carotid artery on the right was 100% blocked, and on the left was 50 to 70% blocked. And this is despite being taken care of by a cardiologist for many years. After these results were obtained, the cardiologist he was seeing decided that based on his risks, based on his other conditions, that the plan would be to maximize medical therapy and to only proceed with heart surgery if they couldn't get rid of the patient's chest pain. And I guess it's important to note that the possibility of like a stent or angioplasty just wasn't there because of how severely his blood vessels were blocked. Unfortunately, patient really couldn't even walk 100 feet before he was getting chest pain. That's what we call angina or angina. And despite any medications that his cardiologist was using, it was severely limiting his quality of life. So because the medical management plan did not make any significant amount of difference for the patient's quality of life, he was referred for heart surgery. Unfortunately for him though, the surgeon thought he would be too high risk for surgery. Based on his liver problems, based on the severity of his disease, based on the blockages in his neck, the surgeon was very concerned about the patient's ability to make it through surgery, to not have any bleeding complications, to not have a stroke with surgery or any of these other things. And so he was turned down for heart surgery. So that was quite unfortunate. Fortunately for the patient though, the surgeon ends up being a colleague of mine and referred him to a plant-based cardiologist in January of 2018. So just a couple months after this whole process kind of started getting going for him. We had an initial meeting. We talked about potential options from a non-medical approach because he had really, they tried everything with medications that they could. And so we talked about the benefits of a plant-based diet. He then wholeheartedly, pardon the pun, transitioned to a plant-based diet. He lost 25 pounds in the last 2 years. We have successfully been able to decrease blood pressure medications. He moved out of the borderline diabetes range, as Dr. Barnard knows very well can happen. And in fact, his repeat carotid ultrasound showed that he had improved flow on the left side, the side that was not 100% blocked. But most importantly, the patient's now able to walk for more than a mile without getting chest burning. He wasn't able to make it 100 feet before he had to stop. And now he's doing fine. And his goal is to get back to jogging. When he was younger, he said he used to be fit. He used to jog all the time. And now he's hopeful that he's going to be able to do this and get back to jogging and get back to being even more fit over time. And so that's the end of my patient story. Or is it really just the beginning? He's had tremendous success. I know from lots of patients in my practice. We know from lots of evidence, lots of data, lots of articles and studies that this is not just one person's experience. This can be the experience of a lot of people. We just need to have everybody on this call, as well as many more people, just kind of spreading the word about the benefits of plant-based diet. Thank you all.
Thank you, Dr. Lieberman. That's outstanding. It's truly remarkable what plant-based nutrition can do, what your body can do to heal itself when you give it what it needs. Our next speaker, Dr. Neil Barnard, is the president of the Physicians Committee for Responsible Medicine in Washington, D.C. He is the author of more than 20 books. He has also led numerous research studies investigating the effects of diet, diabetes, body weight, and chronic pain. He's also an adjunct associate professor at George Washington University School of Medicine, and he's truly an icon in the field of lifestyle medicine and plant-based nutrition. He's speaking to us tonight from the Washington, D.C. area. Welcome, Dr. Barnum.
Well, thank you very much. It's great to be with you. And I want to say a special thank you to Dr. Lieberman for his leadership and for sharing his wisdom. He's helping huge numbers of people, both personally, but also in your policy work to change the way medicine is practiced. So anyway, thank you for that. And thank you for what you've done for such a long period of time. If it's okay, I want to share my screen and I want to talk a little bit about hormones of all things. And I'm hoping that you can see that.
Yes, we can.
The reason that I want to talk about this is up until now, we mostly think of nutrition as a kind of simple thing. You eat a bad food and you gain weight. Or you eat bad food and you get a high cholesterol. Or you eat the wrong things and you get diabetes, and that's kind of it. And so you eat healthy foods. But what I'd like to say is this. Almost every function in the body is controlled by hormones. Hormones, in turn, can be manipulated by simple choices that you can make at breakfast. So the idea is that if you can use the right foods to control your hormones, you've got all kinds of power that you weren't aware that you have now. And by the way, if the little photo strip on the right side of your screen is getting in the way, you can minimize it or you can drag it out of the way, because I'm going to have some things on that part of the screen too. Okay, so the first question maybe is, what the heck are hormones? And hormones are made in one part of your body, and they go in the bloodstream just like a letter in the mail to go to some other part of your body where they deliver a message. So think of hormones as a letter that carries information from one place to another. So for example, your thyroid gland at the base of your neck makes thyroid hormone that goes in the blood to all the cells of your body to give them energy. Or a woman's ovaries make estrogens that go to her reproductive organs to get her ready for reproduction. Or in a man's body, his testes make testosterone that go in this bloodstream to his brain and make him want to run for president, I guess. Anyway, no political jokes tonight. The point is that hormones are information that go from one part of the body to another. And if you can control your hormones, all kinds of things can go so much better. But most of us have hormone haywire of one type or another. What do I mean? You don't get enough letters in the mail. You don't have enough hormones. Or you're getting the opposite, too many letters, too much in the way of hormones. And if you're not in balance, all kinds of problems can occur. So let's start with insulin. Insulin is a hormone made in the pancreas, and it goes in the bloodstream to the muscle cells and to the liver cells. And when it gets there, its job is to act like a key. That insulin key opens up the cell to let glucose inside. That's the whole job. If insulin isn't working right, the glucose doesn't go in the cell, it builds up in the blood, and you end up with high blood sugar or diabetes. So I'd like to show you how this occurs. And if you don't mind, I'd like to show you actually what I'm leading to is the cause of type 2 diabetes. What you're about to see is a muscle cell. This purple oval is a muscle cell. And that muscle cell needs to be powered by glucose. The glucose has to get into the cell. It's all around the outside, needs to get inside. But it can't get in. The glucose wants to power the cell, but it just bounces off the cell membrane. It can't get in. But there are channels that if they would open up would let the glucose in. But to do that, you need a key, and that key is insulin. The insulin comes from where? It comes from the pancreas, right? It goes through the blood to a receptor. And once the key arrives at the receptor, it opens these channels, and now the glucose comes in the cell. Okay, very easy. So what could ever go wrong? What could go wrong is this. My dinner looks like that. My lunch looks like that. My breakfast looks like that, and there's a lot of greasy stuff in my diet, fatty foods. Yeah, there's a lot of fat in all these things, including the salmon or the beef or the chicken, or for that matter, cooking oils. And that fat gets into your cells. As the fat builds up in the cells, the insulin key doesn't work anymore. Doctors call this intramyocellular lipid, but it's just fat inside a muscle cell, and it stops the key from working. It gums up the lock. If the key doesn't work, what happens to the glucose? It can't get inside anymore, and you've got diabetes. High blood sugar because the sugar couldn't get inside the cell. What do? Plant-based diet has how much animal fat in it? A plant-based diet has no animal fat. So this fat starts to dissipate. And if I keep the oils low, the fat goes away, and now the insulin key can work again, and it can allow the glucose to come into the cell. And everybody's happy. Okay, so the National Institutes of Health funded my research team back in 2003 to test a plant-based diet, a vegan diet, versus a conventional diabetes diet. The conventional diabetes diet was cut calories, limit carbohydrate, don't eat bad fat. The plant-based diet was 0 animal products, keep oils to a minimum, and favor low glycemic index foods. White bread is high glycemic index, rye bread is more low glycemic index. It's just a number that shows its effect on your blood sugar. But it's not low carb at all. You're eating lots of healthy carbohydrates. No animal products, minimize oils, low glycemic index. To cut to the chase, the test that we use is hemoglobin A1C. That's an index of your blood sugar control over the preceding 3 months or so. And the people on the conventional diet are shown in red. They had a nice drop in their blood sugar, about 0.4 absolute percentage points. The vegans, however, had a 3 times greater drop, 1.2 absolute percentage points, a little bit more. That's huge. If you had an oral medication that did that, that is the greatest oral diabetes medication you can imagine. And this was done just with eating beans and rice and vegetables and fruits and simple, healthy vegan foods. Vance was one of our first participants. He lost 60 pounds in the course of this study. His doctor, his private doctor said, "You're doing really well. Let's stop your diabetes medications." Imagine what that felt like. But his hemoglobin A1C dropped from 9.5, which is terrible, to 5.3, which is totally normal. I want to tell you, when we saw this is about 2 decades ago, I paced around in my office with his lab slip in my hand for about 10 minutes, trying to decide, could I tell Vance he was cured of his diabetes? Because when I was in medical school, we were taught, once you have diabetes, you'll always have diabetes. But here was a man who pretty clearly did not have diabetes anymore. And now, of course, we see this all the time. As Dr. Lieberman was mentioning, we just see such improvements with diabetes because we're using diets we hadn't used before. They're much more powerful. Oh, by the way, he asked me to tell you his erectile dysfunction went away too. Okay, so healthy diet, fruits, grains, vegetables, legumes. Legumes are beans, peas, lentils. So we've talked about insulin. Let's talk about estrogens, sex hormones. One day I was sitting at my desk and the phone rang and a young woman named Robin called me up. And she said, "Dr. Barnard, I'm being tortured. I'm in misery. I'm in agony." I said, "What is the matter?" And here's the picture that she painted for me. She said, about 1 or 2 days every month, I am absolutely miserable. She had menstrual pain. A lot of women have menstrual pain, but for maybe 1 in 10, you're not going to work that day unless you have a fistful of ibuprofen. And this was her situation. And she said, "Could I give her some stronger painkillers?" I said, "Yeah, I can. I could give you painkillers for a day or two, but in addition to that, how do we stop this from happening next month?" So I gave her a prescription in addition to a day of painkillers. I also suggested something that was frankly an experiment. I said, for the next 4 weeks, no animal products at all and keep oils really low. This is going to be a vegan diet and the oils are going to be scrupulously low. She called me back a month later and said, "Dr. Barnard, this is astounding. My period arrived with 0 symptoms. And the next month and the next month and the next month, she was cured." So I did a research study with Georgetown University's Department of OBGYN. And here's the way it worked. We brought in women who had moderate to severe menstrual pain, what we call dysmenorrhea. Half of them started the diet. Half of them started a supplement, which was in fact a dummy pill, a placebo. After 2 cycles, they switched. The diet group started the supplement group started the diet. So each woman tested both. And we published the results in the journal Obstetrics and Gynecology, and it worked. The diet worked. It reduced pain intensity, it reduced the pain duration, and it reduced the PMS symptoms like bloating and water retention and moodiness that preceded the period. So in the course of this trial, not only was that remarkable, but there was one other thing. We asked the women to remember that we were testing the effect of diet on hormones. So we asked them not to be taking hormones, including the pill, because that would goof up our study. So if they were sexually active, we asked them to use any other contraceptive method, not the pill. One of the women said, "Dr. Barnard, you don't have to worry about me. I don't use a pill. I don't use contraception. I don't use anything because my husband and I are infertile. Years ago, we got evaluated to see why we couldn't conceive. And it's not him, it's me. I don't ovulate. The second month that she was on the low-fat vegan diet, she came into our research center and said, Dr. Barnard, I have some bad news and I have some good news. The bad news is I'm leaving your study. The good news is I am pregnant. And she was, and she gave birth to a healthy baby. And then I didn't see her again for quite some time, but several years later, she came to a lecture I gave with 3 children. The first person we talked about was a man with diabetes. The second person we talked about, Robin, had dysmenorrhea or menstrual pain. And this young woman had a diagnosis of infertility. I think sometimes you can take your number 2 lead pencil and turn it around and use the eraser and just erase those diagnoses, because what they had was a body that was out of balance. Their hormones were not in balance. And when we use foods to get them back into balance, everything can change. Okay, let me walk you through what's happening. Estrogens change in a woman's body. This is during a woman's reproductive years. At the beginning of the month, she has very little estrogen in her blood. But over the next 2 weeks, it rises to a peak and then it suddenly falls. She's ovulating. The ovary is releasing an egg. Then the 3rd week of that month, the estrogen level starts to creep up again because the uterus is the most optimistic organ in the body. Every month, it's convinced this is going to be the big one. We're going to get pregnant this month for sure. So the rising estrogen thickens up the uterine lining, what's called the endometrium. It thickens it up in anticipation of pregnancy. But then at about the beginning of the 4th week, the disappointed uterus discovers we're not pregnant after all. And the amount of estrogen falls and the uterine lining breaks up and it becomes menstrual flow and it's all flushed away. And the next month it starts over again. Here's the key. That changes. That hormonal cycle changes. It can go up, it can go down. And if it's not in balance, problems result. Let me show you a little more graphically. This is the uterus. Off to the side, you see the ovaries. They're connected by the fallopian tubes. That pink inner lining, that's the endometrium, and it thickens up each month in anticipation of pregnancy. Well, what if you've got extra estrogen in your blood, and so that endometrial lining thickens up too much, and now it produces prostaglandins, which cause pain? When Robin called me up, I was thinking in my mind, what are menstrual cramps? It's under the influence of estrogen, you've got prostaglandins hurting you. If we can get your estrogens into the right balance, maybe we can cure you. So how do foods get hormones in balance? How can foods change your estrogens? Well, this is not going to be on the test, but fiber reduces estrogens. Fiber is plant roughage. It's in fruits and vegetables and beans and whole grains. Fiber reduces estrogens. Fat increases estrogens. If you have too much estrogen in your blood, you're estrogen dominant, boost the fiber, get rid of the fat. Okay, very, very easy. We've known this for a long period of time. At the American Health Foundation back, 30 years ago practically, 62 women were brought in and they doubled their fiber intake as part of a research study, and the amount of estradiol and estrone fell within 2 months' time. At Tufts University, a couple years later, same thing. They brought in 48 women and put them on a variety of diets. Each one lasted up to 10 weeks. Some cut the fat, some boosted fiber. But what they found was that even if you keep the calories the same, you keep your body weight the same, everybody's in a metabolic ward where they're not eating at McDonald's or anything, they're eating just prepared foods. If all you do is cut the fat, estrogen drops. If all you do is boost fiber, estrogen drops. If you do them together, you can change your hormones within a matter of a couple of weeks. And that's what we're doing. Okay, let me make this more graphic too. That's your liver at the top of the slide here. Your liver filters estrogens out of your blood. Extra estrogens you don't want, that you need to get rid of to get yourself back in balance. The liver sends them down that green bile duct into the intestinal tract. And when they get into the intestinal tract, those unwanted estrogens actually go all the way through the small intestine, through the large intestine, and they go down in, you flush them away down the toilet. Except for one thing. This requires fiber. plant roughage. If you don't have fiber, it doesn't work. Chicken breast, salmon, omelets, they're from animals. Animals don't have fiber. Fiber is plant roughage. So if you don't have adequate fiber in your diet, the estrogens don't stay there. They don't stay in your intestinal tract. They don't go out with the waste. They're reabsorbed back into the blood. And they end up back at your liver, and they cycle around from the liver to the intestinal tract, into the bloodstream, back to the liver. They're cycling around. Meat-eating women have what we call enterohepatic circulation of their unwanted estrogens. And the way to stop it is to get the animal products out of your diet. When you do that, every mouthful of food has fiber, and it helps to get your estrogens back in balance. Okay, want to make sure everybody's paying attention. So here's your quiz. Spam, fiber or no fiber? What do you think? No fiber? Okay, I have a trash can, and guess what I can do with the spam? There it goes. Okay, KFC, fiber or no fiber? Well,
No fiber.
No fiber. Well, actually, there's a little fiber if you eat the carton. But other than that, no, you're right. Chicken doesn't have fiber. Chicken's not a plant. So we can dump that too. Now, there are some foods that started out as plants, but they became sort of unrecognizable through processing. The fiber was taken out, so that can go too. All right. We talked about insulin, and we can control insulin to the extent we get the fat out of our muscle cells and out of our liver cells. If we do that, insulin can work again. We call that getting away from insulin resistance to insulin sensitivity. We can control our estrogens by getting more fiber, reducing fat. The best way to do that is with a healthy vegan diet. Let's talk about a third hormone, thyroid hormone. So many people are low in thyroid, and because your thyroid oversees your body's use of energy, it affects everything. Let's say you are low in thyroid. There's your humble thyroid. It's kind of shaped like a butterfly at the base of your neck. If you are low in thyroid hormone, your thyroid glands, if it's not making it, you'll feel weak, you'll be tired. It's like your body's just shutting down. Your mood is even low. You stand on the scale in the morning, you've gained another pound. But the opposite can happen. You can be hyperthyroid, where your gland is making too much of thyroid hormone. And there it's pretty much the opposite. Most people lose weight. Once in a while, you have paradoxical weight gain, but your pulse is up, you're nervous, you're irritable, you're just in the wrong gear. What could happen? How could foods be doing this? Okay, well, this is thyroid hormone. The first thing that can go wrong is do you see those big purple globes? That's iodine. If your bloodstream does not have iodine in it, your thyroid gland can make zero thyroid hormone. You have to have iodine to do it. Now, that's not an issue in the United States, because in 1924, the Morton Company started selling these canisters with a little girl holding an umbrella, and it was called iodized salt. Everybody got lots of iodine. Well, then in modern days, people started having sea salt or kosher salt or Himalayan salt. And they don't have iodine in them unless it's specifically marked on the label. And so you get up in the morning and you've gained a pound. And you feel, gee, I'm kind of sluggish. And you look in the mirror and you think, something's wrong with my hair. And your digestion isn't right. And you go to the doctor, and the doctor will say, you know, these may seem like non-specific symptoms, but they're fitting a pattern. I want to do a blood test. And the doctor does a blood test called TSH, thyroid stimulating hormone. And TSH is a hormone that it rises to try to push your thyroid to work harder. And if your TSH level is high, your doctor says, why is your TSH working so hard? You must be low in thyroid. And okay, so if you're hypothyroid, your doctor then says, okay, we can do a variety of treatments. I can give you thyroid hormone for the rest of your life and so forth. But wait. Before we do any of that, let's think about getting you the iodine that you need. It's an iodized salt, maybe a third of a teaspoon a day gets you started, but you might be avoiding that. The dairy industry would love to help you. Dairy disinfectants. I know this sounds creepy. Dairy disinfectants have iodine in them. A cow's udder gets caked with milk, mud, feces. So in between milkings, the dairy farmers will coat the udders, the teats, with this disinfectant. And some of it has iodine in it, and some of it will contaminate the milk. And so they try to use that as a selling point for dairy. There's a much more appetizing form, and that's sea vegetables. You go to a sushi bar, don't have the fish sushi unless you're very well insured, but have the asparagus roll or the cucumber roll or the sweet potato roll. And the nori seaweed that it's wrapped in is a great source of iodine. The wakame in your soup, great source of iodine. The arame in your cucumber salad, great source of iodine. All of these have it. If you're not doing any of that and you're avoiding iodized salt, you can always get a thyroid supplement. 150 micrograms a day has got you covered, but you don't want to not have iodine in your diet. Okay, but now in the United States, because most people are getting iodized salt, that's not their big problem. The reason that they're low in thyroid is because their own body is attacking it. Their body is making antibodies to their thyroid gland. Antibodies are protein molecules. They're made in your white blood cells. Their job is to attack viruses and bacteria and knock them out. But sometimes your body will make antibodies. Your white blood cells make these antibodies. And there's no virus to attack. They end up attacking you. They attack your thyroid gland. And when they do that, you're low in thyroid. That's called Hashimoto's thyroiditis. In other cases, they attack the regulatory machinery so that your thyroid can't turn off. So it just keeps making too much hormone. That's called Graves' disease. It's not a grave disease. It was named after Dr. Robert Graves. These are really common diseases, and many people you know, especially have Hashimoto's, very common. Can food drive this in some way? The Adventist Health Study, very large study, more than 60,000 people, looked at hypothyroidism, and they were struck by this pattern. Vegans had very little hypothyroidism. The people who did the worst were lacto-ovo-vegetarians. They weren't eating meat, but they were making up for it with cheese, ice cream, dairy products, eggs. And the hypothesis was generated that the dairy proteins might trigger the production of antibodies that attack the thyroid. Let's look at hyperthyroidism. Same story, only vegans again do the best by far. They're not consuming animal proteins at all. But now the people who do dramatically worse are omnivores. Dairy protein, egg protein, and meat protein are in their diet. And what we believe is happening is that they act as antigens, causing the production of antibodies that destroy or attack the thyroid gland. Now, no one has yet done a double-blind trial to see if you can cure thyroid disease with a low-fat vegan diet. However, there are a lot of people who aren't waiting for that trial, and they're just doing it themselves. In my book, Your Body in Balance, in the thyroid chapter, I include many, many cases of this that I'd love for you to look at. But I just want to share one with you. This is Nancy. Nancy was 19 years old when her thyroid condition was diagnosed. 30 years later, she decided, let me try something different. She was treated with levothyroxine, very, very common, but still she was overweight, she was fatigued, she was sensitive to classic hypothyroidism. And coincidentally, her weight gain and her cholesterol reached the same number, 265. Well, she went on the diet that I'm encouraging you to follow if you're not already, and that's a completely plant-based diet, vegan diet, no animal products. Her weight fell to 150 pounds, great. Her total cholesterol dropped as well, but her physician did blood tests and said, you know what? You don't need your levothyroxine anymore. And she remains euthyroid, meaning she doesn't have thyroid disease anymore at all. And there she is today. So there she is before with her husband, and there she is after that. And now she's not only lost a ton of weight and feels so much better, but her energy is back. There she is after she ran her 5K. So if you're feeling crummy and you're just not feeling like yourself, it's the easiest thing in the world to check your thyroid, and it's a very easy thing to do these tests and to do the diet and to see if it doesn't help you. Now, don't cancel your doctor's appointment. Don't throw away your medications. Work with your caregiver to see how far you go. All right, healthy diet, fruits, grains, vegetables, legumes, And you should be supplementing vitamin B12. It's very important. You need it for healthy blood and healthy nerves. And you don't need much. You need 2.4 micrograms a day. And if you were dragged to this program by a well-meaning friend, and you're thinking, well, I would love to be healthy, but I don't know if I could really do a vegan diet. It sounds kind of extreme. Let me show you how we do it in our clinic here at the Barnard Medical Center. It is so easy to do. I have never seen anyone unable to make this transition. We break it into 2 steps. Step 1 takes 7 days. During those 7 days, all you're going to do is check out the possibilities. You're not taking anything out of your diet. You can eat meat and dairy, whatever you're eating now, but check out the vegan possibilities. What would I eat if I didn't eat animal products? Take a piece of paper and write them down. Breakfast, lunch, dinner, snacks. Okay, let's see. Every morning I have cornflakes or bran cereal with cow's milk. That's not vegan, is it? Try almond milk. If you never tasted it, now's your chance. I could have oatmeal, but instead of making it with cream, I'll just top it with cinnamon and raisins. And all right, fair enough. I got breakfast. Lunch, I'm gonna have pizza without the cheese. I'll have a chili that's a bean chili. Okay, fair enough. You discover that every Italian restaurant has got spaghetti with an arrabbiata sauce, marinara sauce, pasta e fagioli, sauteed vegetables, all kinds of great things. Latin American restaurants, bean tacos, bean burritos, spinach enchiladas, beans and rice, all kinds of food. Chinese, rice, vegetables, tofu dishes, exotic sauces. We've already been to the sushi bar and they have not fish sushi, but they have the cucumber roll, asparagus roll, sweet potato roll, edamame, miso soup, salad, seaweed salads, wonderful. Now, fast food is not the pinnacle of culinary art, but they've got you covered. Subway would be more than happy to make you a vegan sandwich, and Taco Bell will make you a bean burrito, hold the cheese, and it's vegan too. All right, after 7 days, you got your list. Now, step 2, do a 3-week test drive. 21 days, all vegan all the time. But that is remarkably easy because number 1, you can do anything for 21 days. Number 2, you've already made your list. You know what you like to have and you're gonna go ahead and have it. Okay, so at the end of that period of time, 2 things happen. Physically, you're healthier, but also you discover that your attitudes about foods have changed dramatically. And 1 week to check out the possibilities, 3 weeks to do a test drive, it will absolutely change your life. Let me share with you this app, the 21-Day Vegan Kickstart. It's a free app on your iPhone or on your Android. Menus, recipes, cooking videos, everything you ever wanted. It's the coolest thing in the world. It's in English, also in Spanish. Caregivers give it to their patients, great thing. And this is my book, Your Body in Balance. I got all excited about what foods could do. And so that's why I wrote this book. And the first part talks about fertility and cramps and PMS and cancer of various kinds, PCOS, menopause, and the role of foods in these things. Part 2 talks about the metabolic issues and how we can tackle them. Part 3 says, let's get on a healthy diet. Let's avoid environmental chemicals. Let's have some menus and recipes. And Lindsay S. Nixon pulled together these most wonderful recipes. And she sent me a note saying, Dr. Barnard, your way of eating made my pain go away too. So there we have it. The last thing that I just want to say really quickly before ending is, I hope that you found this useful, but it's important for us to share this information with other people because the people who need this information the most aren't here. They're 16 and they're immortal in their own way and they're eating not very healthfully and they have menstrual pain and endometriosis and all kinds of things starting later in life. They get diabetes and so forth. So let's learn about it. Let's connect. Let's share this information through social media. Share it with everybody you know. Let's make some noise. Let's be megaphones. Let's change this world. Thanks very much.
Dr. Bernard, thank you so much. That was fascinating. And we look forward to seeing you again during the question and answer panel coming up.
Thank you. Now, I do have to apologize that I have to cut my participation in the question and answer a little bit short because I've been called into another medical meeting in another part of the US later tonight. So I'm going to apologize in advance that if there are questions that I can take, I'd love to take them near the top of the hour. So,
Oh, that
anyway.
sounds, thank you so much for what you did already. And by the way, there was a question in here about whether there's going to be recording distributing distributed, and there will be. So everyone gets a chance to go back over just a fascinating tour of the body and many of the things that we can do to help the body out. Thank you again, Dr. Barnard.
Thank you.
Next, we've got Allison Tierney, and she's a registered dietitian and the founder of Wholesome LLC, which is near Milwaukee and Economowoc. She is certified in oncology nutrition, provides individual counseling in person and by telehealth. And she also presents classes and seminars promoting a wholesome diet to control weight and manage and prevent chronic disease. Welcome, Allison.
Thank you so much. I'm so happy to be here and honored to be here. Can you hear me okay, Terry?
Yes, yes.
Awesome. All right, we are going to be starting. I'm going to share my screen here, and we are going to talk about meal planning tips. So Dr. Barnard just obviously gave a wonderful presentation and gave us some ideas about what we can do in terms of how to approach this, but I wanted to give you some other ideas about what you can do, whether you're at the very beginning and you're thinking about transitioning to a plant-based diet or a more plant-based diet, how you can do it in an easy and simple way. So the biggest question that a lot of people ask me as a registered dietitian is, can I actually meet all of my nutrient needs with a whole food plant-based diet? And the answer is yes, 100%. So maybe you're familiar with this image here. This is the USDA's MyPlate. Now, this MyPlate replaced the MyPyramid or the food pyramid that many of us grew up with and familiar with. So as you can see, there's fruits, vegetables, protein, grains, and dairy. However, what's really important to note about this is that actually 63% of individuals across the world are actually lactose intolerant. So they can't actually even tolerate dairy. And when that brings, it actually brings it up to 90% in individuals of different specific ethnicities. So the PCRM created a new plate, which I highly recommend. And I know Dr. Barnard showed it very briefly here, which is fruits, legumes, grains, and vegetables. And so when you think about what your plate should look like, what the USDA was trying to do is try to make this really easy for individuals to say, okay, here's what my plate is. What should it look like? They were trying to simplify the food pyramid, which I think is in the right direction. But here, PCRM has the direction much better in terms of what this should look like. And this is called the Power Plate. So we can get all of our nutrients from a whole food plant-based diet if we eat a plate according to this, with the small exception of needing a B12 supplement. And the reason for that is actually because B12 is a vitamin that's actually created from microbes that usually are in the earth, but how our agriculture practices are and also our sanitation practices has unfortunately destroyed enough of the B12 that we can get enough from plants. So we do recommend a supplement from that standpoint. Now I have a little bit of a similar take on this plate, but this is the plate that I commonly present to my clients and that I want them to think about their nutrition and their plate to be as well. So one of this will be on the far left side, you can see that it's non-starchy veggies make up a big portion of the plate. And then I also like to categorize whole grain with starchy vegetables in the same category. So let's say you have brown rice, or instead that night, you could also do sweet potato. And then instead of like protein, what the USDA says, it's a legume. So whether that be black beans or tofu or edamame, whatever it may be, those are some really great options. And then I like to think about fruit on the side. So whenever we're planning a meal at our house, I think about these 4 main components, and it doesn't need to be fancy in order to make up these 4 components. But the next question is, okay, Allison, you say I can meet my nutrient needs, but am I really going to be able to meet my protein needs? And the answer is yes, absolutely. Now, what's really interesting is what a lot of people don't know is that only 3% of Americans don't get enough protein. And unfortunately, that 3% tends to be individuals that have extremely calorie restricted diets. And if those individuals simply ate more calories, they would be able to meet their protein needs. Now, on the flip side, only 3% of Americans actually meet their fiber needs. And as Dr. Barnard was talking about, we need that fiber to help pick up any excess hormones or toxins or any medications that might have been metabolized by the liver. We need that fiber to help pick those excess things out and take them out of our system rather than reabsorbing them. So we go to the grocery store and oftentimes we're so looking at there's protein cereal here and protein granola bars and anything you can think of when it's just not necessary. And in fact, research also shows that even vegans and vegetarians in the US tend to consume 70% more protein than they actually need. And my hypothesis is the reason why even these individuals consume too much protein is that they're led to believe that they need to supplement their protein with so many other sources, so it ends up being in excess. So why is protein something that I'm thinking about? Well, this is just one of the studies that's available. However, a study that was published in 2014 found that high protein diets, which are all the rage, for those between the ages of 50 and 65 had a 75% increased risk in overall mortality or death, and 4 times more likely to die from cancer within the next 18 years. Those are pretty shocking numbers. Now, if that protein instead came from plant-based sources, because we're not negating the need of protein in our diet, because we still need protein in order to build muscles, restore muscles, hormone creation, what it may be, we still need protein, but we just don't need it in the amount that so many of us consume it. But this particular study found that if the protein intake was derived from plant-based proteins instead, the association or the risk of death or the cancer was actually eliminated or weakened. So here you're getting the benefits of plant-based nutrition, you're getting the benefits of fiber-rich foods, and enough protein to help meet those needs. So here is a very quick example of what this particular day could look like for an individual that to easily meet their protein needs, such as oatmeal with soy milk, blueberries, almond butter, and chia seeds, then a wrap with lentils, salsa, and greens, and an apple, carrots with hummus, and then also for dinner, I like to think of this as like a hash, potatoes, black beans, some veggies, and a banana. This whole day right here is 63 grams of protein. And 63 grams of protein actually is 13 grams over what a 140-pound individual would need to meet their protein needs. Now you might be saying, okay, Allison, I weigh more than 140 pounds, so I'm going to need more protein than that. That's true, but you also just need more calories. So if you simply ate more amounts of food of these high quality foods, you'd easily be able to meet those protein needs. So here's a quick example of what a plant-based plate could look like in terms of those 4 different categories: your legume, the whole grain, or the starchy veg, a vegetable, and a fruit. Now, with that being said, I'm a huge advocate for meal planning. And you don't have to have recipes to actually make plant-based eating possible. In fact, some of the best meals I ever create are ones that I don't have a recipe for. And if you really sit and focus on these 4 main components, I really think that you'll be very successful. But keep in mind, when I work with my clients, the meal planning is one of the most crucial steps for success. And my individuals that do the most amount of meal planning and do it consistently have the most success in not only their plant-based diet transition, but in their overall health and the success that they're looking for, whether it's to reduce or eliminate medications, to achieve a healthier weight, to hopefully achieve pregnancy, and so many of these other things. Meal planning is key. So I just wanted to give you a couple quick tips on what effective meal planning could include. I really highly recommend making sure that you have a go-to place for recipes. There are so many different places that you can find plant-based recipes now, such as the 21-day Kickstart from PCRM. I also have a 5-day plant-based guide menu that I'll share with you after this, so you can go anywhere. I also really like having a calendar or a board of some sort, but you can even just have a piece of paper and a pen and write out what you're going to be having for whether you want to plan out breakfast, lunch, and dinner, or just plain the dinners. I like to meal plan in my kitchen so I can open up my pantry and look in my fridge and see what I have already and what I can use to make it. So again, I might just say, okay, we have brown rice, we have black beans, we can use the veggies that we have in the fridge and add a piece of fruit to it together and just throw it all together. Maybe the fruit on the side though still. Also know your family's work schedule for the week. This is super important. I oftentimes have people that will plan their dinners for every single night, and then they get very overwhelmed by the amount of information and recipes that they have. But it's not necessarily realistic to have to cook a meal every single night, because maybe you're going to your parents' house or your children's house for dinner, or maybe you have an event that you're going to be having dinner at. Plan according to the schedule. Also, make sure that you make a grocery list while you're planning it out. That makes it so much easier. Also, plan to have leftovers. Leftovers are amazing. And I rely on leftovers a lot for my lunches, and it just makes it so much easier. Don't be afraid to utilize the freezer, especially now in the winter here in Wisconsin. If you make soups or chilies, these are great things to make in double batches to freeze off for another time. And also keep in mind is that you just keep it simple and make it a habit. So one last thing that I wanted to remind you before we transition is that if you're new to plant-based eating, or this is an overwhelming concept for you, I want you to remember that transitioning to this is just like learning how to ride a bike when you were a toddler, or how to play an instrument. It's not necessarily something that just like happens like that, although some individuals can pick it up really quick, but just try and give yourself some grace as you move forward. So lastly, I'm actually going to take this PDF slide. I know we had to move through the information pretty quickly, but I'm going to add it into the chat function so that you guys can go ahead and grab these slides. And when you get the PDF, you can go ahead and click on here, and that will bring you to my 5-day meal plan as well. And I look forward to answering any questions for you in the Q&A portion of this. And I'm really looking forward to Amber Lee's cooking demonstration next. So thanks so much for having me, everyone.
Thank you, Allison. That was outstanding. And thank you for getting so much information in such a short period of time, and look forward to seeing you during the Q&A. Our next speaker, Amberly Childs, is a plant-based chef and cooking instructor, trained and certified through the Physicians Committee for Responsible Medicine's Food for Life program. She founded and heads Milwaukee-based Plant Joy, where she offers cooking classes and more. Like Dr. Liberman, she is a regular speaker at our monthly PBNOW meetings, and Allison also is an occasional speaker at our meetings. Amberly's passion for plant-based food is contagious, and I can't wait for you to see it firsthand. And we're going to start off with a video from Amberly, and then she's going to speak to us after the video is over.
Good evening, everybody. It's Amberly Childs with Plant Joy, and I'm so excited to be here tonight. We're going to be going through 2 wonderful recipes, completely plant-based, completely easy, unbelievably delicious. You're going to be blown away at how easy these are, and I really hope you try and recreate them at home and upcoming. So a little bit about me before we get started. I am a Food for Life instructor, as I said. I'm also a 10-year cancer survivor. I had breast cancer in my 30s. It was very aggressive, and I had the wonderful opportunity to be knowledgeable and work with an integrative oncologist, and I used food as medicine throughout my entire treatment. And now I use food as medicine to help keep my body optimal, living healthy, and to prevent recurrence of disease. So however you are using plant-based foods, whether it's to lower your weight, whether it's to prevent heart disease, whether it's to prevent cancer, food is medicine, and know that it can be wonderful, it can be delicious, and I'm going to show you 2 great recipes right now. So the first one we're going to be jumping into is a winter squash spread. We're going to use a butternut squash. However, you could use a butternut squash, you could use an acorn, you could use both of those and mix them together. I like to use root squash. Butternut's one of my favorite because it's super sweet, it's very delicate, and I just love it. So we're going to be using butternut squash today. The other ingredient is we're going to be using shallots. Shallots are on the sweeter end of the onion, not as potent as like a red onion would be. And we're gonna then caramelize those onions down. I have an extra leek in the house, so I'm just gonna throw that in there as well because onions are in the Allison family, super cancer fighters. And so why not just throw that leek in there because I have it in the house. We are then gonna add in a little bit of nut butter. We're gonna put it all in the food processor. We're gonna blend it up and it's just gonna be a wonderful dip, and we're gonna serve it on a toasted crostini with some raw vegetables as well. The second recipe we're doing is a penne with kale, tomatoes, and olives. And that is so simple, so delicious. But let me tell you, simple does not have to be uneventful. It doesn't have to be bland, and it can be super tasty. So we're gonna do that as well. I'm using a food processor tonight. So this is my butternut squash. I went ahead and skinned it, cubed it, and then I baked it in the oven. So it slightly started to caramelize a little bit. And now I'm gonna take that and we're gonna put it into our food processor. And I can smell, it's really warm, and it's got that caramelization, which kind of is a sweetness, and it's just delicious. Second thing we're gonna add in there is our caramelized leeks, and you can see the little shallots that I got going on there. And so these are nice and caramelized, and I do wanna add that I did a no oil saute. I am a low to no oil chef, and that's because oil is not necessary. It is not something that we really need in our diet, and it is completely loaded in fat, 100% fat, and therefore if we can eliminate it or choose to use it very sparingly, it will definitely benefit our body a lot. So we're gonna add that in there. The third ingredient we're adding in, it calls for 3 tablespoons of almond butter. We are going to substitute, however, sunflower butter. And let me tell you, if you haven't tried sunflower butter, it is super tasty. We're substituting it tonight because my daughter has an almond allergy, and sometimes people might have a peanut allergy, and you might substitute almonds for the peanut, and that's great because almonds are going to be a better fat than your omega-6s that you're going to get in your peanut. However, we're going to substitute the almond and we're going to use a sunflower seed. So sometimes seeds can be substitutes for nuts if you have nut concerns or nut allergies. So we've got 3 tablespoons of that, and we're putting that in as well. There is a little bit of moisture that's taking place. It's inside those, and so we have a little bit of, where'd it go, vegetable broth here that I'm just gonna barely put a little bit in instead of oil as needed. So you're gonna hear a little bit of noise now. Got my food presser locked in, that way it's safe, food's not gonna fly everywhere, and here we go. I'm gonna step away because it's obviously gonna be a little bit louder. I'm gonna add my homemade vegetable broth, just a tiny bit. I'm gonna stop it. I'm gonna come in with my spatula, and I wanna see what does the content look like, and just give it a little bit of a spoon around. I'm gonna show you guys. It's starting to chum up nicely there. We could also use a blender here. However, the blender is gonna really take it down to baby food or like a puree, and we're not wanting that right now. What I'm looking for is it to have a little bit of chunk, and you still wanna see a little bit of the fibers that are inside that butternut squash. This is coming together nicely. It has like this smoky flavor, almost like a smoked paprika type thing. And that's really the caramelization that's coming through. Oh, it looks so unbelievably good. So this, my friends, is our wonderful, look how nice this is. It's thick, yummy. And I'm gonna go over and I'm gonna spread this in a second. Our next dish, which is a penne, where we're using kale, tomatoes, and clamato olives. So once again, I've got my saute pan going here. We're doing a no oil saute. I've got diced onions that are gonna go ahead. You hear that? Ooh la la, it sounds like we're cooking, right? Because we are. My husband said this so long ago, and I love it. He said, anytime we have people over, you should just saute onions before they come over, because the whole house will just smell like you've been cooking all day long. So there, take that little free tip and treat your company, or you know what, treat your spouse or your partner or your kids or whomever is in your home. Treat them, because unfortunately we're not having a lot of gatherings right now because of COVID-19. But we will, I know this. So I'm gonna let this go. I had a little bit of onion skin here, which is what I'm peeling out. So I've got that onion sauteing on here. Once again, I've got my vegetable broth or water right by, and as this starts to caramelize and stick down onto the pan, I'll be able to add my water. And what that water or vegetable broth will do is it will deglaze the bottom of that pan, and all of that sticky stuff, that browning, that caramelization is going to be lifted up, and it then will be added into our flavor profile. All right, so I'm turning this baby up to high. Ideally, we want to cook and let these flavors marry together for about 15 minutes. So I've got the onions going. The second ingredient we're putting in there is roasted tomatoes. So these are diced tomatoes. This is a real easy workaround here. I could have chopped up my tomato, but I went ahead and cut the corner and bought it in the can. 1, they're organic. 2, it's a BPA-free lining, which makes me feel comfortable. And then 3, they're fire roasted, so they get this extra caramelization on there that works super well with what we got going on. We have some fresh chopped parsley that I'm going to put on at the end. We've got some sliced Clamato olives that we're going to put in there as well. And then the last ingredient is our kale. And I went ahead and chopped up some kale, and I'm just super excited to share this with you. The kale and the parsley came from my garden, and if you don't know, I live in Milwaukee, Wisconsin. We have had snow already, and kale is still growing. So while these are continuing to saute, I'm going to show you really quickly with my knife the best way to cut a piece of kale. Okay, see this? You take your knife and you come down and you just slightly turn it. 1, 2, 3, and then the kale comes off. Obviously, we'd be catching it. And then you can take your kale. I like to then put it in water. From there, you can then pull it out of the water. And when you're pulling it out of the water, what's happening is the dirt and the dirties that's from growing are coming off of that. So the caramelization, you can see here, I got a little bit of browning that's starting to happen. How about that? Looking really good. Now what we're going to do is we're going to add in the tomatoes. The recipe calls for 28 ounces of diced tomatoes. Remember, I went with a roasted tomato. Yum, 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 yum. We're going to mix these in and just let it to continue to cook. I've got it on a medium-high temperature right now, stirring it all together, and then I'm going to add in the kale. If you have family at your house that are like, we don't do kale, cut it really small. I cut this into small little ribbons, small little pieces, because that kale is going to cook down. And that is going to make it easier to digest. It is going to make it easier. Visually, it's going to be a little bit nicer, especially if you've got people at your house that maybe aren't kale lovers yet. If you have people who are concerned about any ingredient, whether it be greens or anything, chop it up a little bit smaller, and I bet you'll find you won't notice it or they'll like it all together. So, finishing up here, I've got my pasta. This is the corn and brown rice rigatoni noodle. I just cooked that. I'm going to add this in here. I'm going to go ahead and put some of my parsley in here. While this is continuing to cook, I'm going to go ahead and add in my olives. I left in a little bit of the olive juice because olives are really salty, and that's what makes part of this dish fantastic. And so that salt works really well, and the brine that those olives are in is really yummy. So I just took a little bit of that. We also are getting the juice that comes from, you can see we're looking good so far. The juice that comes from the tomatoes is really nice in here. So right now I'm going to go ahead and just slowly add in a little bit of the pasta, and I'm going to keep stirring. The pasta's already cooked and it's warm, but we're just giving it a little bit more heat right now. It's so pretty, the colors. I mean, this is just a dish for you to really get in there and enjoy. All right, I'm turning this off. I thought I was turning it off. How about that? I'm gonna dump it all into one bowl. I'm gonna give it a final mix. I'm gonna top it off with some nutritional yeast. Could be for a vegan Parmesan cheese, but I'm a nutritional yeast fan. My kids love it, my household loves it. We use it all the time and it gives a nice cheesy flavor to anything. We'll top it off with a little extra parsley. Manja. Look at that deliciousness. We've got our wonderful dip. In this dip, you can see how nicely you just add it on with a spatula. You come up here, add it on. I might try some fresh rosemary on here. Maybe some air fried sage might be fantastic. The trick is that you want to use greens on top. They're gonna give a nice visual pop and people are going to love it. I've got some chopped up peppers, and this here is our winter squash crostini spread. Continue to eat plants, get those vegetables, fruits, grains, beans, nuts, legumes in. The high fiber is really what helps us fight disease. In addition to the antioxidants, all the nutrients, plants are powerful. They can help you heal. They can help you stay healthy. Eat more plants, get in the kitchen, and keep cooking, everybody. It's been a lot of fun. I hope you'll try these recipes at home. Bye-bye.
Thanks, Amberly. That was outstanding. And Amberly, are you going to speak for a minute?
Yes, if we have a minute.
Yep.
Thank you, everybody. I hope you enjoyed those. Really, one of the things that I love and I've learned as I've been a self-trained chef and is that really creating healthy, amazing dishes is not that difficult. We just have to attempt it. We have to try, get in the kitchen. And Allison gave us some really wonderful tips on how to prepare instead of just getting to that 3 o'clock, 4 o'clock time every day and going, oh, what am I going to have for dinner? Putting a little preparation and a little energy and time into what you're going to be eating throughout the week is a great, wonderful idea. So I hope you'll try these recipes. One of the comments I saw was somebody said, I don't like olives. What could we put in there? Substitute that. My suggestion, first of all, there's a couple different things, but one of the things I might suggest is one of a nut, maybe of your one of your favorite nuts. A nut's going to bring in good, healthy fats. And then it's also maybe going to bring in a little bit of the saltiness that olive might have been bringing in. So try those recipes. Don't be afraid to make substitutions when you have a recipe. If you look at something and you don't have an ingredient, the show must go on. You still have to eat. We can't just abort the mission and throw that, the recipe out. We have to continue. So be creative, be flexible with yourself, and get in the kitchen. And then the other thing I want to add before I chime off is a lot of my cooking classes, my clientele have come to me and said, we really love the recipes you make in cooking. And out of that has evolved a wonderful soup business. And so I see in the chat box here, some of you have already been chiming in, and thank you for your wonderful comments. But Plant Joy has a plant-based soup delivery business. And so every Monday we deliver soup and sometimes other things like veggie burgers and some fun plant-based things are on our menu. But most of the time we have soups, stews, and curries. We deliver directly to you in the greater Milwaukee area, and delivery is included in the price. And so if you're somebody who says, hey, I want to eat plant-based, but I'm not sure if I have the time, the energy, or maybe I'm just not really a great cook, we are with you. And as Dr. Barnard said, you can eat out and still be plant-based. You can order out, or we could deliver it to you. So check out my website at plantjoy.net. This week's soup is a dill pickle potato chowder, and it is off the charts. And let me tell you, it's a Polish favorite. And if you like dill and you like potato, this one's for you. So I really want everybody to get in the kitchen. And as a cancer survivor who uses food as medicine, who's Dr. Kumar, I've been a patient of hers. I can honestly tell you that really finding your love of food and finding connection is going to help benefit your mind, your body, your soul, your spirit, and all of those things. And it's a process. It's a journey, and be kind to yourself on this journey. And I guarantee every day you're going to be a little bit stronger and a little bit better and healthier. So stick with it, you guys.
Thank you so much, Amberly. And just to follow what Amberly said there about the soups and the veggie burgers and that type of thing, and what Allison had mentioned earlier, you know, if you're putting a week together, you can always freeze some of these things as for something to eat a little bit later. So excellent job, and thanks so much. Let's take a few remaining minutes to show you how you can connect to some of the local and national plant-based community for resources that can help you be successful and answer your questions in the long run. We quickly go through the slides. If you find one that you have an interest in, you might want to take a screenshot with your phone or computer. And you're also going to receive an email in the next few days from the Physicians Committee with links for each of the presenters. So first, if you're looking for plant-based cooking classes, be sure to check out Amberly's next class, which is a holiday edition on November 18th. It's going to be virtual, so no matter where you are or where you live, you can tune in. And Amberly also mentioned about her soup business, and that's outstanding. A lot of the people in the event today are already enthusiastic Amberly soup consumers. Let's move to Dr. Kumar. If you can get to know Dr. Kumar by scheduling an appointment at the Omani Center for Integrative Medicine. The Omani Center is just west of Milwaukee. By the way, Dr. Kumar also wrote a book about health during midlife that's available. Next, you can connect with dietitian Allison Tierney at Wholesome LLC in Oconomowoc, either in person or by video conference. And Allison provides plant-based nutrition education, counseling, recipes, and more. Connect with Dr. Lenz at Pro Healthcare in the Delafield, Oconomowoc area, again, just west of Milwaukee. He's a pediatrician and internist and is about to release a book called Conquering Fibromyalgia. His book describes a comprehensive approach, including the benefits of a whole food plant-based diet to moderate or eliminate chronic pain. And I also want to tell you about Dr. Lenz's wife, Joy. She's a plant-based dietitian and launched her own business, Bring Joy to Your Kitchen. She does group classes, cooking videos, individual nutrition counseling, and has an open Facebook group called Plant Powered Joy. It's just terrific to see couples with the same passion for plant-based nutrition. And Dr. Barnard already mentioned a few of the many resources, and there are a lot of resources the Physicians Committee offers, like the 21-day Kickstart Meal Plan app and his latest book, Your Body in Balance. With Thanksgiving right around the corner, it's time to start thinking about your holiday menu. Take a look at all the delicious recipes that PCRM has compiled for you in their free e-cookbook. And finally, please join us again. December 10th is our next PBNOW monthly meeting. Dr. Lieberman and Amberly will be there, along with our featured speaker, plant-based family and lifestyle medicine physician, Dr. Lori Marbas from Colorado. Dr. Marbas is a former colleague of Dr. Joel Furman. And besides being a practicing family physician, Dr. Marbas is editor of the Disease Reversal and Prevention Digest and senior managing editor of the International Journal of Disease Reversal and Prevention. Every month we host a meeting with a different speaker, and we'd love to have you with us again. If you do have an interest in joining us, but you're not currently set up to be informed of our upcoming meetings, it's easy. You can go to our website, and it's listed right there, pbnow.org or pbnow.org. And if you go to the homepage or the first page that comes up there, just click on the white Learn More button. And if you leave your name and email address, you'll receive regular invitations to our upcoming meetings and events. So to finish, thank you so much to our speakers and panelists tonight, and thanks to all of you for joining us. We hope you leave feeling inspired and better connected to the local plant-based community as well as the national plant-based community. And as a reminder, we'll share the links for each presenter in a follow-up email. So be on the lookout in the near future for that email coming from the Physicians Committee. Thank you and good night.